Hey, I'd like to welcome you to another episode of the Mission Matters Luxury Podcast, your source for all things luxury and lifestyle. My name is Adam Torres. You can follow me on Instagram at AskAdamTorres. Keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Jillian Stewart on the line, and she's founder and executive director over at Surf and Turf Therapy. Jillian, welcome to the show.
Hi, thanks for having me.
All right, so excited to get into today's topic. So we're going to talk about the principles behind Hippo therapy and surf therapy and why they work. But before we do that, let's go a little bit further into what you're doing over at Surf and Turf Therapy. Tell us a little bit more about your business, please.
Sure. So we are a 501c3 nonprofit, started in 2018, and we provide physical, occupational, and speech therapy services for individuals with disabilities. But we use non-traditional approaches of surfing, horseback riding, and other community-based activities.
That's awesome. And I think that's a perfect transition. Let's just jump right into today's topic. So principles behind Hippo therapy and surf therapy. I mean, where do you want to start with this one?
Let's start with the hippotherapy side. So I am actually a hippotherapy clinical specialist, and hippotherapy means treatment with the help of the horse. And it dates back, as early as the 60s. There were people using horses and their movement to help people with physical disabilities. And so the really unique thing about being on a horse is your pelvis moves in the same three-dimensional movements that it does when we're walking. So it moves forward and backwards, side to side, and it rotates. And we have been unable as therapists to replicate this in any clinical setting. You can't use a swing, a ball, a mechanical horse. The results are just not the same because when you're on a horse, you get 3,000 repetitions of finding and refinding your balance. And it's in a repetitive, rhythmic movement pattern that's really, really beneficial to our nervous system. And it trains our muscles how to work together in the right way while also building our strength and our balance. So that's my original background. I've been practicing in hippotherapy for over 6 years, but I also fell in love with surfing along the way, and I started learning a little bit more about surf therapy. And a lot of the current research in surf therapy is around mental health and how surfing can help with things like PTSD and confidence, but there's not a lot of research yet about how it helps physically. Based on my background with using the horses, I saw a lot of parallels between sitting astride a horse and sitting astride a surfboard as far as how physically it can impact our nervous system. So we use the surfboard with our patients with disabilities for very similar things. We work on stretching, we work on postural alignment, we work on their core strength and stability, their ability to follow directions, what we call regulation, so their ability to kind of keep their nervous system within what's considered a normal range instead of getting super excited or super underwhelmed. And so there's a lot of carryover between the two, which is really nice, and why we kind of married them together in surf and turf therapy. And we can work with, a variety of ages and a variety of disabilities using both of these forms of treatment.
Wow, that's absolutely amazing. And it sounds like it's like just much more engaging, and it's just much more, fun. Not to take away the other part of it, but if I'm thinking about, my child or wanting to kind of bring them in to, get some help, it's like to be with the horses and to be out there in the water. It just sounds like it's a better experience.
Exactly. A lot of these individuals who are living with lifelong disabilities spend hours and hours and hours each week in different clinical offices for different treatments and therapies and doctor appointments. And this is a way for them to get the same benefits they would in the clinic, and sometimes beyond that, but in a more fun and, unique setting that can really transition to a lifelong activity. I have a patient parent who has 6 children, and I work with her youngest son with Down syndrome. And she said, living down in San Clemente, I thought one of my kids would be a surfer, and none of them were into it. And now here he is. He's just the normal surfer of the family, and it gives them that sense of normalcy and pride watching their kids do these activities. So it's not only fun for the patients, but it's fun for the families as well. And we really encourage and support inclusion, and so we invite family and friends to join in sessions too. So we'll put a sibling on the surfboard next to their brother or sister, or we'll put a parent on a horse riding with their child. So we really want to emphasize fun, functional, and inclusion-based treatment approaches.
So what are the because there's some people listening to this right now, and they're possibly thinking, hey, they're in that San Clemente area and they haven't really considered this. What are the right types of clients that you like working with? Like, what are typically the range, if you will?
Sure. So we work with pretty much anyone age 2 and up. Typically, if you go much younger than 2, there's not enough strength in the kiddo's neck to make it a safe approach. So we wait until about 2, but that being said, there is really no cap. I work all the way up to geriatrics. Right now, my oldest patient is 84 years old, and she loves it. She comes and rides every week. So that's pretty much our age range. And then as far as for different diagnoses, we most commonly see autism, cerebral palsy, and Down syndrome. But we see a wide variety of different diagnoses, including multiple sclerosis, spinal cord injury, Angelman syndrome, stroke, traumatic brain injuries, pretty much all diagnoses. Unless, there's a few red flags that we look out for to make sure it's safe. But for the most part, anyone and everyone can participate and benefit.
Oh, that's amazing. What kind of response have you heard, like from the parents, from the patients? I'm just curious. It just sounds like such an amazing thing.
Oh, I mean, every day there's some different thing that touches me and makes me excited to come back to work the next day. The biggest thing, like I said, is when the siblings can really connect and the families can really connect through what we're doing. I have a sibling pair surfing with me, and they really kind of butt heads a lot. They don't like to do a lot together. And when I offered them to have, separate surf times, they said, no, we love doing this together. This is so much fun. Like, this is our one thing. So I really like just being able to bring together the community, whether it's the kids, the families, the volunteers, etc.
Oh my gosh, what an amazing story. I love it. So Jillian, if somebody's listening to this and they want more information on surf and turf therapy, what's the best way for them to reach out and to connect with you and your team?
Sure. Our website is just our name spelled out. So surf and turf, therapy.org. Our Instagram handle is exactly the same, surf and turf therapy. So those would probably be the best ways to reach out. There are direct links on the website for, a contact box that'll email me directly, and then I'll get back to you usually within 24 hours.
Fantastic. Well, Jillian, really appreciate you coming on the show today and sharing more about your mission over at Surf and Turf Therapy. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. If you did, don't forget to subscribe to the podcast, leave me a review on the Apple iTunes Store. And if you're watching this on our YouTube channel, Mission Matters Luxury, definitely give us a subscribe there and leave us some comments in the video. Love to know what kind of projects and things that you're working on. And Jillian, thanks again for coming on the show.